even a small study is very, very important. Researchers should not think like they have not done big, research and inventions, so they should not. Even the smallest thing they should highlight, they should publish, they should bring it to the community, and everyone should know. They should publish their findings. A woman in its whole life, menstrual life cycle, creates 600 kgs of carbon dioxide. Carbon dioxide emission is there, and like 300 million menstrual waste, which is non-biodegradable, created per annum globally.
And welcome to another exciting episode of the Truth in Research Conversation, an initiative of the Sentinel Research Lab, where we bring together academics, across the globe, innovators, professionals from the world to share authentic experience, insights, and practical lessons that can inspire and empower the public, particularly the next generation of early career researchers. So in today's episode, we have Dr. Vishva Jeotsna, if I actually pronounced that very well.
And, that's right. Yeah.
So thank you for joining us today. So Doctor, can you kindly introduce yourself?
Myself, I am Dr. Vishva Jeotsna, co-founder and CEO of Vishva Jeotsna Enterprises Private Limited. We are, we have developed a highly innovative menstrual hygiene product, which can revolutionize the menstrual hygiene field as well as the sustainability also. And the brand is My Bliss. So we want to expand and introduce our product globally, as well as in African countries and LMICs. So I really want to change the menstrual health scenario of women globally, and also save the planet. So this is my mission. I have launched a Red Revolution campaign so that women can have access to safe and sustainable product, each and every menstruating woman. So I want to expand this campaign across the globe.
Okay, thank you very much, Dr. Vishva, for that. Now, for many people listening, so I'm going to start by saying a lot of people are listening, and for them, menstrual health is usually discussed only from a biological perspective. So how would you actually define menstrual health broadly, and why should researchers and policymakers pay more attention to it?
Yeah, actually, we define menstrual health as the World Health Organization defines that menstrual health refers to complete physical, mental, and social well-being in relation to the menstrual cycle. Menstrual health includes access to safe and affordable menstrual products, clean water and sanitation, adequate education and awareness generation on menstrual hygiene, healthcare support for menstrual disorders like POS, PCOD, freedom from stigma and discrimination. Yet, globally, millions of women and girls still face lack of access to safe sanitary products, poor menstrual education, social stigma, school absenteeism, reproductive tract infections, and unsafe menstrual practices. In many lower and middle income countries, menstruation still remains a taboo subject. Because of this silence, policy, research, and investment in menstrual health have historically been limited.
Yes, that's true. Completely. Yes, of course.
Yes. The field is.
Yes, go ahead.
Yeah, please continue.
Okay, all right. Okay, so, I think a lot of, just like you said, the last thing you said, a lot of research hasn't really been done. Like, there is actually a lot of limited research. And so many people actually have this biological, kind of perspective about it. Little attention is actually really going into research, when it comes to publishing relevant findings that can actually inform policy, because there is a lot of gap out there. And I would say that there are some misconceptions when it comes to a lot of things that deals with menstrual health. Now, I want to ask a question right now. Looking at your wealth of experience, from your experience and some of the powerful work you've been doing across some of the communities, because I've seen a lot of things that you're doing, in the communities, how you've been impacting, and some of the awards that has already been attributed to you. Now, what are some of the major gaps that you feel like they're actually overlooked, in menstrual health research, particularly in Africa and low and middle income country? Let's look at it from what are actually those gaps that you can see from the experience you've had going into the communities that you feel like has actually been overlooked, particularly in menstrual health research.
Okay. So, what I have perceived, the current gaps in menstrual health research, especially in low middle income countries, is lack of local data.
Yes.
Many countries still do not have national menstrual health surveys, reliable prevalence data, product usage studies, infection surveillance systems. Researchers can contribute by generating country-specific evidence. Next gap is limited interdisciplinary research. Menstrual health is not just a medical topic. Menstrual health intersects with public health, biotechnology, sociology, gender studies, environmental studies, economics, education, and material science. So, more interdisciplinary collaborations are urgently needed.
Yes.
The next gap, which I perceive, is insufficient innovation research. There's growing demand for biodegradable sanitary pads, antibacterial technologies, reusable products, sustainable absorbent materials, pH balancing menstrual products. But many innovations are not rigorously tested in local settings. All are in the laboratory. So researchers can bridge the gap between innovation and evidence.
True.
And the next gap is weak policy translation.
True.
Research findings often remain in academic journals and do not influence policy. So lower middle income countries need researchers who can translate evidence into policy briefs, engage governments, work with NGOs, communicate findings clearly to the communities. And the next gap is underrepresentation of African and lower middle income countries researchers. Because a large portion of global menstrual studies and health literature is still dominated by institutions from high income countries. So local researchers understand the cultural beliefs, the behavioral patterns, the mental attitudes, and community barriers. So their voices are essential.
True. I totally agree. Of course, like that is really true because, particularly in terms of the evidence that is really, really underrepresented, when you look at some of the output in terms of research publications that are actually informing insight, you see that most of the researchers from LMICs are not really doing so much. And this is really something that is playing a very significant role in terms of policies, better policies that can actually help in, proper menstrual health, management and other practices that are quite very effective. So let's actually look at it from this part now, because you've really talked about some of the major gaps. And I'm sure there are definitely a lot of students who are out there that you've mentored, maybe probably in the university and even in the communities. There are a lot of young people who are actually interested in research, who have been part of what you're doing. Now, I want to actually ask a question now. How do you think, somebody who is an early career researcher that wants to contribute, particularly, maybe they feel like lack of funding, mentorship or direction and all of that. So what's actually that practical advice that you're going to give to someone who wants to start meaningful work in menstrual health research? What is that advice that you have for them to actually break through these barriers to participate in menstrual health research?
Yeah, actually, according to the funding and career for researchers, uh, the good news is the menstrual health is gaining global attention. So potential funding sources include global health foundations, women health initiatives, innovation grants, government health agencies, international NGOs, and UN organizations. So key areas that attracting funding today include sustainable menstrual products, adolescent health, gender equity, wash programs, antimicrobial technologies, climate friendly health innovations. So, young researchers should look for fellowship, mentorship programs, incubators, research competitions, startup accelerators, and networking is equally important. They should attend conferences, webinars, public health forums, innovation summits. So these spaces often lead to collaborations and funding opportunities.
Yes. That is really true because you talked about applying for grants. But how about in a situation? Okay, let me ask you now from your own experience. Now, how about in a situation whereby some of the researchers are not familiar, particularly with how to apply for these opportunities? What do you think they could do? Because a lot of people who are actually out there who wants to engage in menstrual health research now, because we're talking about menstrual health research now, and maybe you can see somebody in Delhi or maybe in a rural area in India, and they don't even know how to apply for funding. What do you think could be a possible way out from your own experience?
Yeah, actually, from if I say from Indian perspective, nowadays, like their government of India has launched lot of programs for researchers and innovators and startups, so that there are a lot of funds available,
Yes.
for them, so that all the time these funds are being advertised, so that researchers can have an access. They can apply to incubators, through universities and startup, so that they can receive the grants. So a system has been created in India for this.
Wow, that's really very, very phenomenal because a lot of times you find out that some people might actually complain, oh, they don't have maybe the right internet connection, or maybe they don't have what it takes to get started with research. Because basically what we want to address is that people have their own passion, and there are a lot of people that wants to do this type of research, and you are saying that, okay, that through university programs, maybe following up with the government initiatives for funding, that could actually really work out well. So looking ahead now, what do you really think is what, on your own perspective, what do you think the future of menstrual health research, what do you think it looks like from your own perspective? What does the future look like? Yes, because basically a lot of people have they could say that young researchers are shaping the future, right? And even before you actually look at that, you will see that there is a lot of changes and all of that. So what's the future like? Because we're looking at the fact that there are a lot of stigma, right? In terms of cultural stigma, people are stigmatizing. Each time you talk about it, I know some of my friends who, whenever you talk about topics like menstrual, oh, they feel it's just for women. Don't talk about that here and all of that. And people have these social beliefs. And as a person said, I doubt doing maternal health research could be maybe, unless it's something that maybe the department has brought, or something that's not really related to my area of research. How do you think, based on all of this now, what do you think the future of menstrual health research looks like?
Okay, the future of menstrual health research is incredibly exciting because the emerging areas include smart menstrual products, infection detection technologies, biodegradable absorbents, antibacterial and pH balancing pads, circular economy models, AI driven reproductive health analytics, and climate resilient menstrual solutions. We are also seeing strong integration between public health, entrepreneurship, biotechnology, and environmental sustainability. So, Africa and other lower middle income countries are not just beneficiaries of innovation, they can become global innovation leaders.
Yes, true.
Local researchers can create solutions specifically designed for local realities, and those innovations can scale globally.
True, that's true. Of course, yes. So, but okay, if I would want to ask you something like, how do we really think, people can build trust with communities to conduct ethical research? Because for you to conduct, for any career researchers to engage in menstrual research, they still need some kind of ethics from the community. Do you understand? To engage in this kind of research. I'm sure, of course,
Yeah, yeah.
looking at your background, you've done a lot of insights, you've published findings, you've engaged with the community. How do you think we can build that trust, looking at what you've painted the future of menstrual health research to look like?
So, menstrual health research requires cultural sensitivity. Researchers must remember that menstruation is deeply connected to identity, religion, tradition, and privacy. So, ethical research practices are essential. Researchers should obtain informed consent, of the community with whom they are interacting while they're doing focus group discussions, interviews, conducting studies. Then protect participant confidentiality.
Wow, that's true. That's true. Yeah, of
Then
course. Yes. Yeah, I
and
I think
use respectful language as well.
yes, yes, of course, yeah. So, can you just throw one light in terms of the using that respectable language, like on your own? How do you think? Like when you say
Pardon?
using ethical languages, how do you mean?
I mean, the researchers should respect the community. First of all, contact with community leaders, then try to know their cultural beliefs, and against they can't go against that, no. So they should try to understand the cultural beliefs, engage community leaders, include women and girls in decision making. All these things they should do. Avoid imposing their own assumptions. Instead of co-create solutions with communities.
True, true. That's true. So, let me just kind of look back to some of your last community project, that you worked on, because when we started this, that you talked about your mission and some of what you're doing in your team, right now. Because I see that you're a change maker and you're somebody that is really focused on making serious community impact. Can you really tell us more about the project you guys are really doing in terms of menstrual health and menstrual health research?
Yeah, definitely. Because during my work tenure, I have worked with lakhs of self-help groups, women self-help groups, and came across lot of marginalized women who have been deprived from all the basic facilities which the governments are providing. They're so poor to afford all these things, and they are into the trap of using traditional practices of menstruation like grass rags us, and therefore, like in India, like 70% of women are having bacterial or fungal infections.
Are you serious?
And the thing is that out of the 70%, 90% of the infections have the capability of getting converted into cervical cancer, reproductive, infections, infertility. So it's alarming. Like, I mean, India is the highest contributory to cervical cancer deaths and prevalence of cervical cancer.
Wow. And
So
and, and yes,
it's the
true.
need of the hour. Yeah.
Yes,
It's
it
a
is the
need of
need.
the hour to
Yes, yes,
introduce
yes.
such kind of product, which I have developed, through research, and it's a very innovative product which balances the pH of the body. It's antibacterial and maintains the natural biome of the vaginal area, and it's biodegradable as well.
Wow.
It's
So
a wonderful product.
yes, yes, that's nice, because a lot of people definitely, in other settings, in other African settings and other low and middle income settings, might also want to know about these inventions, because as change makers, it's very important that we talk about, people get to see the impact that we are making. Do you understand? So that's going to really help, in providing more solution. We're not going to leave everything for the government, right? On our own, there are also homegrown solutions that should scale. So, what do you really think about the scalability of this solution that you're talking about? How do you think it can scale to other parts? What do you guys have intentions of bringing it out to the public, also in other areas like in Pakistan, in basically in other parts of the world?
Yeah, actually, we have started exporting We have registered ourselves on so many B2B platforms, and we are in contact with so many buyers and importers who can really value our product, and especially in the countries where women are more aware. Because the thing is that in most of the lower and middle income countries, I mean, women are not that much aware about the health consequences of poor menstrual hygiene. They just think is any product which is having absorbency, only that product can serve their menstruation. But actually it's not that. We are not serving, our product is not just serving absorbency. It is a health first product, health first alternative, which is solving, besides the absorbency, it is protecting a woman from bacterial and fungal infections. It's maintaining the natural biome of the vaginal area, maintaining the pH of the vaginal area, and it is biodegradable as well. So all these things are combined into one product, so that you, on one side it's protecting the woman's health, and the other side planet. Because I want to tell you the data that a woman in its whole life, menstrual life cycle, creates 600 kgs of carbon dioxide. I mean, carbon dioxide emission is there, and like 300 million menstrual waste, which is non-biodegradable, created per annum globally, which is non-biodegradable, and it takes 20-50 years to decompose. So it's alarming, like. And my product, if it is used by, we have just calculated the thing, if our product is used by 10 million women, it 6 tons of carbon dioxide emissions can be saved, reduced from the environment. Then when non-biodegradable sanitary pads are buried under the earth, under the landfill, it produces a gas named methane, which is very, very harmful, and it's a potent greenhouse gas. So we'll be able to reduce this methane on a larger extent. So this will be the we'll be able to reduce the microplastics that are being used in the non-biodegradable sanitary pads, because most of the 99% of the sanitary pads available in the market are non-biodegradable, and these are contributing to greenhouses gases, carbon emission, which is very, very harmful for the environment and for the woman's health as well. Because once the woman uses the non-biodegradable sanitary napkin, the atmosphere of the vaginal area, which is acidic, becomes basic, and a woman becomes prone to bacterial and fungal infections.
True.
So yes, this is the repercussion of using non-biodegradable sanitary napkins. So that's why I was totally committed to develop such kind of product which can help both the environment as well women's health. So that's why we came to develop this, and finally we developed this product. Well, the name is My Bliss.
Yeah.
Our brand is My Bliss.
Honestly, that's really mind-blowing. Dr. Vishva, I want to ask, like, are there like a very strong partnership you guys are having with some research labs, there in India? Like,
yeah, we are having a partnership with the institution like KIET here in nearby Delhi. So they are the scientists who have developed our product. There's so many good institutions, laboratories, who can help anyone to conduct research and all those things.
True, that's possible. And of course, a lot of young researchers, looking at the very massive work that you're doing, if giving some of these inventions, these products that you are coming up with, they will definitely be very, very intrigued and passionate to understand the SOP, behind the invention, and also see how they can engage more and unravel insights. I'm sure you have a lot of mentors out there who you are currently mentoring.
Mm-hmm.
Yeah, of course. So yes, and a lot of them are quite very passionate. So if I'm going to ask you, like, maybe like one of the last thing I want to ask you before we conclude is, now looking at all of these are actually really beautiful work, and I'm sure the world is really passionate to hear about some of the beautiful things you're doing, and the hard work you guys are putting in to make sure that menstrual health research is one that it is very, very much promoted. There is a lot of evidence that is being brought in, and researchers get to publish a lot of papers. Now, so I want to ask you now. So, what is one message that you would want every young researcher, listening today to remember? And what would that message be? What is one message that you want to pass to that person who might not really know where to get started for, but they want to be like Dr. Vishva? They want to be like you, and they want to have that capacity to do a lot of beautiful things that you're doing. So, what's actually that one message you want to pass to them?
The message is that even a small study is very, very important. Researchers should not think like they have not done big, research and inventions, so they should not. Even the smallest thing they should highlight, they should publish, they should bring it to the community, and everyone should know. They should publish their findings. Especially they should try ResearchGate, other journals, university journals, and from there they can get funding also, because all the universities have a certain kind of fund for the researchers, and government has also prioritizes researchers to, if they are being innovative in such product which can have a big impact on the community and the environment as well, so they will definitely promote and fund those researchers. So they should keep on publishing their inventions and researches, and then keep attending seminars, conferences. So this is my message to them.
Yes. Wow, that's actually very, very much of a very beautiful one. I want to say very, very big thank you. Like over the past couple of minutes, you've really shared a lot of like wonderful insights, and I'm sure our listeners, you heard it. This is the Truth in Research podcast, and our mission is to make sure that a lot of young people out there, early career researchers, get to hear from global experts. They get to hear from people who are already doing something phenomenal in the field, and this is across several fields. Field of healthcare, field of engineering, artificial intelligence, machine learning, all of that. And now looking at what we heard about menstrual health research, I'm sure a lot of people definitely would know that there is actually a distinction between menstrual health and menstrual health research. So I actually want to say a very big thank you for your time, and I want to say a very big thank you once more, and thank you so much, and hopefully I get to come.
Thanks for inviting me. It's my pleasure to be with you on this podcast. So thanks a lot again.
All right, see you. Excellent.
Thank you.
Yeah.